According to the CDC, stroke is the 5th leading cause of death in the United States. My name is Keith Ernsberger. I've been a paramedic for 15 years, and today I'm going to give you some information that'll help you be able to better recognize the symptoms of a stroke that could be happening in a family member or friend of yours. So, what is a stroke? Well, without getting too technical and too in-depth with the anatomy, basically your brain is an organ no different than any other organ in your body. It requires blood supply. That's where it gets all its oxygen and nutrients, is through the blood. And it gets that through veins and arteries. These vessels feed it that blood. So anytime that blood gets blocked or doesn't get to where it needs to get to in the organ, that's where problems will arise, and that tissue of that organ will start to die. So we all know that your brain controls your body, right? Everything's controlling your brain. Well, different parts of your brain control different parts of your body. So it's very important to understand this, because with the assessment, this makes more sense understanding this. So like my speech to you right now, that's being controlled by one part of my brain. The way I'm moving my hands, that's being controlled by a different part of my brain. So depending on where that blockage of the blood not getting to the brain is happening in the brain is going to depend on how the stroke is manifesting in each individual. So, and this is typically occurring in 3 different ways. One, it could be a hemorrhage. The vessel, these blood vessels, the veins and arteries literally are ripped and blood is leaking out and just not getting where it needs to get to because it's leaking. It's not getting there because of rupture in the vessel. Or the other two are the most common, where a clot blocks that blood from getting there, or a piece of plaque stops it from getting to that part of the brain. So that's basically how a stroke happens. It's critical to understand that a stroke is a time-sensitive, true emergency. Anybody having a stroke needs to get to a hospital as quickly as possible. I can't stress that enough. So just keep in mind with any of this, trying to figure out if someone's having a stroke, if you think they are, call 911, get professionals there to get them going in the ambulance as quickly as possible to the hospital. Okay, so how can you better assess, be able to understand stroke, how to better assess somebody potentially having a stroke? Here's what I want you to remember. An acronym: FAST. F-A-S-T. Okay? The F stands for any kind of facial weakness. Any problems with one side of the face or the other, not moving right, drooping down, facial weakness. A stands for arm weakness. Inability to move one side of the arm or the other, or real weak with moving one side of the arm or other, or even the whole body, one side of the body or the other. S is speech. Any kind of speech difficulty, whether that be inability to speak at all, would be a big one. Coming up with wrong words, or words that don't make sense, or kind of mumblings. These would be indication of a stroke. T is the one I already went over. It's time. You want to ask, how long has this been going on? Because you want to get them to the care they need as quickly as possible. So T is time. So with that FAST exam, any kind of, again, facial weakness, arm weakness, speech difficulty, and how long has it been going on, the time, with assessing those things, and you can assess those things by not even being there. Let's say a family member calls you on the phone. Hey, I just don't feel right. You could go over those basic things with them right there on the phone. Do you have any facial weakness or anything? What about your speech? Are you having difficulty speaking? And you can even assess that on the phone while they're trying to talk to you. But ask them, any arm weakness? How long has this been going on? These are things you can not even be there for. So you're going to be able to detect 70% of strokes with just remembering that FAST method. But there's also those other 30% of strokes that require additional testing, and I'm going to go over that with you too. And remember, this field of medicine is constantly changing. They're constantly doing more research into this, and this what I'm about to teach you comes from the University of Miami Miller School of Medicine, and it's called the MEND exam, MEND, and this is an acronym that stands for the Miami Emergency Neurological Deficit Exam. So the first thing you want to test is their mental status. Ask them to repeat a simple phrase. Ask them to say, repeat after me, you can't teach an old dog new tricks. If they can't repeat that, there's something going on, potentially a stroke. Next, ask them a basic question that they should know the answer to. What's your birth date? Who's the president? What month is it? Simple stuff that anybody should know the answer to. If they don't know that or have trouble thinking about it, potentially a stroke. Ask them to follow a basic command of, hey, can you open and shut your eyes for me? If they can't, and you're not testing their eyes, you're just seeing if they follow the basic command of opening and shutting both eyes. If they can't do that, again, potential stroke. Next, cranial nerve test. Ask them to smile for you. This is testing that facial weakness that we already went over with the FAST exam. Ask them to smile, and when they do, their cheek muscles will raise up their cheeks, and if that's not working like it's supposed to, it'll be real easy to tell. Only one side of their face will raise up. Again, indication of a stroke. You can also check their visual fields. Get about 20 inches away from them, put your hands off to both sides of them, and just kind of flash your hands like this, and move them up and down, and have them look forward and say, okay, which hands am I flashing? If they can't see you flashing one side or the other, that's an indication of a stroke. Stroke can manifest where the vision of one side is completely gone. Horizontal gaze. If they have one eye that just veers off to one side, if they're looking at you and one eye is gazing off to the other side, and it could be either eye, they could be looking at you here and this eye gazing off, that would be an indication of a stroke. Coordination test. So these tests are, you're touching the coordination and sensory. So I already went over with the FAST exam, any kind of arm weakness. Well, the way we test that is what we call arm drift. So ask the person, all right, can you put both hands out like this, palms down, and shut your eyes, and have them hold them out there for like 10-15 seconds. If one side, while their eyes are shut, starts to drift down, if they have that weakness where they can't hold it up, this would be an indication of a stroke. And you can do the same thing with their legs. They don't need to shut their eyes for this, and you can do the legs one leg at a time. Have them sit down and just raise one leg up. If they can't raise one leg up, this would be an indication of a stroke. Sensory, just have them shut their eyes and say, I'm gonna feel your arms and feel your legs. Tell me which one I'm touching, and just simply do that. Have them shut their eyes and just kind of lightly pinch their arms, one arm at a time. Which arm am I touching? If they can't feel you touching one arm or one leg, indication of a stroke. Coordination, you can do a simple like sobriety test that the police officers use. Put your finger about 20 inches away from their nose, and ask them to take their finger, touch your finger back to their nose. If they have trouble coordinating that back to their nose, this is an indication of a stroke. So that's it. Just to recap, there's the FAST exam, F-A-S-T, any kind of facial weakness, any kind of arm weakness, any kind of speech difficulty, and time. I can't stress enough the time sensitivity of somebody having a stroke. They need to get to a hospital as quickly as possible. So I hope this helps you. And just remember, if you're not sure, if you have any doubts, call 911, get professionals in there, have them assessed. Thanks for your time.